guys. Well, welcome to the Advocating for Change webinar with Kelly, Barta, and myself. We're really excited to talk with you about this today. It's a very, very important topic, obviously, for us. The reason we got involved in ITSAN is because of the problems that we see in healthcare and our experience, and we just realized that things have got to change, and there's not another group out there that's doing this. It's really down to us. So very, very thankful that you guys were able to set aside some time and join us today, and we will run through some things that you can do to advocate for yourself, as well as some things that you can do to advocate for others. And it's really a very individual journey, so no pressure to do anything. I might pressure you a little bit to report to the FDA, but that's it. Anything else after that is, you know, it's the cream on top, right? So let's go ahead and get started. The things that we will cover today is finding your why, like why do you care about advocating? What is it exactly? How do you do it? What's it look like? We do have an advocacy toolkit that we'll run through as well, just to kind of get you started with the initial steps. And then Kelly will top us off with a discussion around grassroots advocacy.
So the big why. I'll jump in. Like Jodie was mentioning, I think all of us have had a moment in time where the flip is kind of switched in us, like, okay, enough's enough. For me, it took a really long time. I just wanted to get through this. I think that's initially how we all feel. I'm just going to get through this and get on with my life. But because of what happened in me, there was a time that I just couldn't do that anymore. So a lot of you on this call know me and you know my story, but for those of you who don't, I started TSW 12 years ago. And within, you know, a couple of days of stopping steroids, use that I had used for 26 years, my skin started to burn. As you can see, I'm all red. It was top to bottom. I was in a full body flare for several years, but really bedridden for a year and a half, lost on my hair. You can see it starting to come back here, but it came out in big patches. And I was bedridden, basically living between the bed and the bathtub. You can see me here. I lost a ton of weight. I literally probably lost about 30 pounds. I was just like a skeleton with red skin on it, and was just profusely shedding every day. You can see my arm here on the top right. It's just so weird how it swells up like that. But I would take baths all through the day and was constantly getting all that skin off. So you don't see the skin that you see on other people a lot with the shedding, because I just needed it off my body. But anyway, this was a period of time where I thought, okay, you know, I'm just going to get through this, get on with my life. And I started to feel better, but then was exposed to eczema herpeticum and was hospitalized. And you guys have probably seen these pictures, but nearly lost my life. It spread so rapidly on me that nobody knew what was going on. They didn't know how to treat me. It was really, really scary. And just the fact that I didn't have the kind of medical support that I needed at this time too was infuriating, but also it terrified me, because I thought if I don't have medication or my medication stops working with the antivirals, this could take my life. And I couldn't imagine a worse way to die, honestly. So after that period of time, I went into this dark cave. And I think those of us who have gone through TSW have experienced this. I just wanted to crawl in the back and not fight anymore. I didn't have anything left. I mean, dealing with fear, dealing with just a body that betrayed me, I felt like, and that I couldn't control, was really, really scary. It affected my family severely, my marriage, my kids. I felt like this thing had basically just taken my life. It's stolen my life from me. And I just didn't want to fight anymore. Sorry, I'm getting emotional. But then I was talking to my sister one day, and she called me back up to who I was. She reminded me who I was. And, you know, it was through that conversation, and honestly, I don't exactly know what happened, but it was like this fire started rising up in me, and all of the grief and the anger and the fear and the perplexity and all of that started being channeled into this fire, and this roaring fire. Like, I don't care what this takes, this has to stop, and I'm going to do whatever needs to be done, even if it kills me. And I'll tell you, you know, I was that person who was, you know, the little girl hiding behind her mom's skirts when I was growing up. I was very shy, very intimidated by people's roles. And so I had a lot of inhibitions, but that fire that started rising up in me burned all that stuff away. It's like none of that mattered anymore. And it started me on a journey. And that is really what this is about. It's not like, hey guys, let's do a webinar and learn 5 steps of reaching out to your legislator today. This is a journey for all of us. And I think it's self-realization. It's also changing of our worldview, but it's also getting involved to make a difference. So really excited to share with you today. And I'm going to hand it over to Jodie, and she's going to also talk about her why. And then we're going to get into the nuts and bolts.
Thanks for coming out of that cave, Kelly. I don't like that slide.
You're welcome.
And that's honestly, hearing stories like Kelly's just really sort of pisses me off, quite frankly. And I'm like, this cannot happen. I'm such an idealist that I really believe that, people are trying to do the best they can, that the world is put together in such a way that, you get what you deserve and what goes around comes around and it's all goodness. And then this happens. I'm like, whoa, wait a minute. This is not right. And I remember the singular moment that I became an activist. It was in the middle of the night. I'm downstairs. Everyone else is sleeping peacefully. And I'm furiously just itching, scratching. And this was in the early days. So it was a couple of hours, literally every single night when I was experiencing this. And everyone else in the world literally was completely oblivious. And I thought, you know what, my doctors have no idea what has been created in me. And they don't care because I haven't cared enough to tell them. So how can I expect them to quit doing this to other patients if they don't know that it's actually happened? And that's when I realized that there is no one else. It's got to be us. We are the ones that can make a difference. So my journey was a lot less horrific than maybe many of you, and certainly less than Kelly. I never had to quit working. It was never full body for me. It's only ever been upper body, pretty much what you see here. And I think I'm a slow burner. I never really had the flares where it comes and goes and I have good skin in between. It's been pretty hellacious the whole time. I did try Dupixent for about 10 months and got much needed relief from that, but the eye impact was quite severe for me. And I got off of it. And so I'm still dealing with it. I wouldn't say I'm 100% healed, but it was just that moment in the middle of the night when I realized that we have to do better than this. This is not acceptable. And you guys have seen all the baby pictures, and the parents at their wits' end. Oh my God, I can't believe I've done this to my child. We can't let that go on. We have to stop it. So that's kind of why I got involved in ITSAN. And way back then, I did put together, I would say the first version of the advocacy kit. And I did get that updated today. We'll cover it today. And that is in the Facebook file. So hopefully you can find it while we're talking and kind of go through it together. But that's sort of my why. And I think Kelly and I both are, and all of you have done a lot of work in this as well. We're all fighting for those people that are walking in the same path right behind us. Mm-hmm. What do we do to get them off of this path? These babies that you see didn't choose this, right? So I think it's just keeping in mind your why and why you're doing, the reason that you want the change. Why does it matter to you? That's what's going to kind of light the fire, as Kelly says, and carry you through the next actions that we can take.
So we just wanted to, again, highlight, like we did at the ITSAN conference, the prevalence and the proof of what we're asking for and the change that we want. So it's not enough to just come with your story many times, because people can write that off or say, oh, that's just your perspective. But when you want to make change, you have to have prevalence, you have to have proof. So this is something that when we talk to decision makers, you need to have these numbers front of mind. So if eczema is affecting around 10.1% is what they say in the US, it's much higher in other places in the world. And frankly, I feel like it's higher than that even. But even that number is over 3 million people here in the United States. Dr. Fukaya did a study where he published that he believes steroid dependence and the withdrawal ensuing afterwards is 7 to 12% of those using steroids. We know that pretty much everyone who has eczema and has been diagnosed has been prescribed steroids. So if you take that number out of our 3 million in the US, actually, I'm sorry, it's 30 million in the US. If you take 10% of that 30 million, that's 3 million people that could be addicted to steroid medications and not realize what's coming ahead. That's a lot of people, and that's probably a small number, but these are very important things to think about. And when you're either going to your state legislator or you're going to on a federal level, you bring your number. As far as your state goes, it's like you find out, okay, how many people live in my state? Now do the math, 10% of that is eczema, 10% of that number could be TSW. So just an easy way to figure that out. And then the proof, again, we showed 2 of these slides, and this is just hot off the press coming off of that survey that we ran last year, and it's been analyzed and we're getting it published now, so we can't share everything. But these stats are staggering and break my heart. It's something that, like, I'm so happy that we have this, like, it's been such a long time coming, but it's so devastating to see that these are thousands of people living right now, this very second, dealing with this stuff. And that hurts me because, we've all been there. We know exactly what it's like. So we need our prevalence, we need our proof.
And these are the data points, right, Kelly, that we can pull into our own stories when we're talking to, our state representatives or industry representatives. Those data points matter. That's what's going to that's what's going to make a difference.
Right. They need to see that there's science behind this, not just people's stories. And this is new. This is something that is, as far as looking at steroid exposure in patients and what happens to them over time, nobody else is really doing this. Nobody's looking at it. And with the topics like us who have eczema, many times allergies, asthma, we're getting steroids from multiple doctors, using them for a really long time for different things, and nobody's really keeping track of that. So that's what we wanted to do here. And this is what we're showing. This is not okay. This is not okay for patients, and something has to change. So when we go into advocacy and what is an advocate, I remember thinking to myself, well, an advocate is just someone who's going to speak up for someone else. So that could be in a lot of different arenas. But then the more involved I got in advocacy, it was more the traditional sense, like you go to your policymakers and you change laws. That's what advocacy is. It really isn't. It's more than that. We're going to be talking about both, well, your different options as far as advocacy goes. But just to go through this, to define it correctly, and this is pulled from dictionary.com, an advocate is a person who speaks or writes in support or defense of a person, cause, etc., or it's a person who pleads for or in behalf of another, an intercessor. And I remember when I started getting involved myself, and it was scary. I'd never done anything like that before. I had no idea what to expect and what was going to happen. Many times I felt like someone was going to choke me. I didn't know how to get the words out because it's scary. But when I was in that place, I would think back to myself, and many of you have heard this before, but I thought to myself when I was in bed, what I want the Kelly here today with this opportunity, with this open door, what I want her to speak and tell the story, even if she does it wrong, even if it's maybe not in context, even if she stumbles and makes an idiot out of herself, would I want her to? Absolutely 100% yes, I would. And so now, instead of that Kelly back in the day, I also have this sea of people that I think about, like the picture we just saw recently of the thousands and thousands of people who are suffering and they don't have medical support. Their partners are leaving them. Their life is falling apart. They're losing their careers. It's like they don't even know if they can make it through another hour or week or month. It's not okay. So we are standing up and we're doing something on behalf of another. And what is advocacy? Advocacy is the act of pleading for, supporting, or recommending. Active espousal. So everybody can make a difference. Every single person. There's something that all of us can do. And Brianna, nice to see your face on here again. We went to the International Investigative Dermatology Conference together, and we exhibited and talked to researchers there, which it's easier than you would expect. A lot of people were very interested, and they looked at the book of stories that we put together. And then we got to go to Harry Potter World afterwards, which was a total blast. Anyway, what I wanted to do here was show you a little bit of a landscape. A lot of times when people think, okay, we need to make change, who do we need to go talk to? Let's go talk to the president, you know, like I'm going to write him a letter and he needs to change it. And, or I'm going to go talk to, and I did this myself, I'm going to talk to the president of the American Academy of Dermatology. And I set up an in-person meeting in Detroit. We were there in Michigan, and I set it up. I met with him and he's like, why are you here? It was kind of like, well, what do you mean? Why am I here? This is important. You need to understand about this. But what I began to realize as time went on is that there's a chain of command. There are certain people that are more effective to go to than others. And you just have to understand the landscape. You have to understand how the games are played and how change actually happens. So when we take steps back, so first we look at, okay, how did this happen? What's the problem? How are we going to change it? Well, then you have to really dial yourself back and say, how do we get there? We can't just call up the FDA and say, you need to change the labels. I tried that. I reached out to them so many different times and it was total crickets. And I'm like, why aren't they responding to me? What's the problem? Well, when I found out earlier this year, when we're trying to set up a meeting with FDA this fall, there are 13,000 people on campus at the FDA. I had no idea. It is like a huge machine. So it makes sense why my little email from a person just kind of got lost in oblivion. You have to understand the process and you have to understand who you need to talk to. So basically just to run through these steps that we can do that is going to make change. We can start with general awareness with our friends and family, talk to them about that, get them involved in the process. You can put stuff on social media, which I know a lot of you do. That was very hard for me to do, and I still don't do it often. I'm a pretty private person, but that is so effective and needed. So we need to talk to our healthcare providers and the general public about this. Then we need data. We need not just our anecdotal stories that people could or could not take seriously. We need good hard data, scientific clinical research. So we do patient-reported surveys. We want to put together a patient registry that's actually tracking people over time. We need people to pick up clinical studies and actually look at what's happening, like Dr. Shiri did in Australia, where she followed people for 2 years and then she published on that. That's all important. We have to get a diagnostic code, and that is done with the World Health Organization, but we can't get that unless we have the studies until we have actual diagnostic criteria that they can put around this condition so doctors can look at it. They look for these different things that are happening. Now they can diagnose someone, right? So we need a public health advisory really mandated by the FDA. And that's what we're going to be talking to them about this fall. We need them to mandate product label changes, but that's something that the manufacturers do. It's like understanding what the roles are of all these different associations and entities out there. Then, from those product label changing, then we need those physicians educated about it. They need to understand the new guidelines really that need to be created. So it's all of these different steps in order for us to see doctors who understand this and who are going to support us correctly, people who are not going to overuse steroids, all of these different things. So just wanted to kind of give you a quick overview of that to better understand how can you move forward? Like what's your part in that? How can you sort of make some progress ahead with us? So I'm going to hand this back over to Jodie to talk about the toolkit.
Oh yeah. So let's break this down into practical steps. I have to share my screen. 1 second. So this is the advocacy kit, and these are practical steps that you can take in order just to feel like you're actually doing something. And this was set up in such a way that if you are still recovering or you've got really, really tough days where it's just an effort to do laundry, you can just do one thing at a time, and you can do one thing a week, one thing a day, whatever you want to do. But it's just to kind of keep the progress going. So we'll talk about the intro, the checklist. The first thing, and I think we mentioned this during the Spark conference also, the number one thing that any of us can do is to report the adverse outcome to the FDA. Here's the link specifically. This is a PDF that's uploaded in the Facebook group under files, the ITSAN Facebook group under files, and these are active links. So step 2 is to gather a few of your TSW photos. You saw Kelly's, you saw some of mine. I think it's helpful too to balance it with your either pre-TSW photo or your after ones if you've healed enough, just to show that, who you really are. Next, we'll have you kind of collect all the doctors' names in one place so that you can sit down next time and just send everything out at once. So if you've seen, 5 doctors, get them all in one place. It'll just make it a lot, I think, to get the next step going, which is a letter to the doctor, and I'll show that to you in just a moment. The point I would make on this one is that we are all very emotional about this condition and our experience with it. The problem is the medical community is not, and all they care about is initially is the data. What proof do you have? How many people are experiencing this? Isn't this extremely rare? You have to kind of speak to them with a level head, a level voice, be unemotional, just put the facts forth and get them on board and curious. I think that's the key, is to make them curious about what the heck happened to you, and is it really this many people? And then they'll put their heart into it when they're ready to. And I would recommend too that writing the letter is really good. I would also send an email to your physicians as well. And we want to see those pictures too. Jolene is actually looking for pictures now. If any of you have some that you'd be willing to share, you can send it to info@itsan.org. And that is a monitored inbox. Another thing that we would like to do is to take those photos and your story and put that into a patient experience document. I'll show you one, for example, in just a minute. We have about 75 of these things, and they're all in a binder. We take them to conferences with us. The doctors will literally stand at the table and flip through them. Brianna, you probably had that experience at the conference a few years ago. There's also a brochure. We are in the middle of updating it, FYI, but there is a brochure. Here's a link to it that you can take to your doctors. You can give to your family members, your neighbors. You're concerned about how many steroids are slathering on their kids. Just hand in the brochure. For US folks, there's a couple of links here where you can find out who your state representatives are if you're unsure. And then that will help with putting a letter together for your state representatives, industry leaders, what have you. Lastly, I did include just today a plea. We really tend not to ask for money much. It gives people sometimes a bad taste in their mouth, but I think enough people also see the value, I think, in what ITSAN is doing, that they want to give and they want the opportunity to support ITSAN, which is fantastic. And there are such things as recurring donations. Some companies are like, hey, employees, if you want to support a charity or a nonprofit, that's great. We will match your contribution to them. That's double the money. That's fantastic. So we need to get more of those. And it would be fantastic if we could have recurring donations. So it's a steady income each month that helps make our activities more predictable. Can we really afford to send someone to this conference? I mean, ITSAN is not a big organization. It's not 13,000 people like the FDA. We are literally 5 or 6 people. Most of us have full-time jobs. Kelly and I both have full-time jobs outside of ITSAN. We're not paid for any of this. It's not comped. It's all volunteer work. We do have a couple of people that we do compensate, very, very minimal. So we're definitely looking for donations pretty much all the time. For the matching funds, the employer will need the tax ID number and the address, which I've included here. And lastly, and you guys are all good candidates for this, we need board members. So it's been the same group for the most part. Kelly and I for, 3 years now. And we've lost a few board members, not lost like they died, but just they stepped down from the board. But we really need to have some new people added. Our newest board member is Michelle Lee. She's a data scientist. It's going to be a fantastic contribution to the board, but we're definitely looking for new people to join. And you don't have to yes, I'll be a board member. The first step is just join one of our meetings and see if you like the conversation and where it's going or how we handle things. We would definitely welcome you to that. The rest of this is just examples. So here's the letter for your doctor. This is one I sent to my doctors, and I tried to be as unemotional as possible. I took some other stuff out actually this morning. I did add also, so I talk about, what do we want? What do I want from my doctors? Number one, go check out the position statement between NEA and the British Association of Dermatologists. That's official. I mean, TSW is real, right? I asked them, go research this condition. There's a for doctors section on ITSAN.org. There's a ton of research out there. There's no reason that they wouldn't or they shouldn't look at this and be curious about it, right? Brianna, our superstar in the community, see the Preventable documentary. Make it an office project, you know, like, hey, let's go have a watch party on Friday night. We'll watch Preventable. It's made a huge, huge impact. And Brianna, I think we've thanked you a billion times, but I'll do it again. Thank you so much for seeing that project through. It's a fantastic documentary. And lastly, just asking the doctors, hey, these are serious medications. This is not so safe. We use it on babies. I still remember hearing that. I'm like, oh, okay. I can put it all over my face then, no problem. There's some other recommendations in here. I don't want to spend too much time on this. Here's the example patient experience. I just threw mine in here because I give permission. I didn't have to like ask someone, hey, do you mind if we share your stuff publicly? So this is, you know, how often I used it, how long. That's a picture from, I think, 2014. Here's some images of me going through TSW in the beginning, had this crazy redness pretty much every evening. Yeah, those are fun. So that's what it's a 2-page sort of layout, just kind of gives some images, gives quick history on how you use steroids, how often, for what. The next thing in here is an example of a letter to your government representative. What'd you call that earlier, Kelly? State, maybe
Elected
state.
official?
Elected officials, yes, that would probably be better language for our international friends. But this is just an example of, you know, telling your elected official about it, and then secondly, making specific asks. So we're asking our elected officials to allow exceptions to step therapy. You want to give a quick overview, Kelly, on what that is?
Sure. So some of the biggest things that I have advocated for that sort of connect with step therapy and TSW. Sorry, I was reading your question, so I was a little like, got to get back into the mode. Step therapy is basically when insurance companies require you to take certain medications before they'll cover like more costly medications. So a lot of times, especially if you're switching insurance companies, which in my state of Georgia, because we were under an individual plan, every single year we were having to change insurance companies. So I think I've gone through like 4 or 5 in the last 7 years. Well, they have these protocols in place because it's a way for them to save money and cut cost, is by, instead of just, you know, approving all of these high cost medications for patients, we're going to actually require them to do these cheaper ones first. If they don't work, fine, then we'll finally allow you to, you know, take them later. Well, people in our position, we don't have that option to take steroids. Those are the least costly medication for us, right? That's what we're prescribed all the time by doctors, but that is not an option. So what these laws around step therapy do, it doesn't completely take it away, they're still allowed to use step therapy, but they are required to consider certain exceptions. So what it does is it puts those decisions back into the patient and the doctor's hands again, not the insurance companies. Insurance companies should not be determining what medication is best for you and what you're allowed to have, right? That should be you and your doctor. So it's just putting guardrails around that protocol and not allowing insurance companies to get away with this anymore. So as far as that is concerned, step therapy, that's pretty self-explanatory for TSW. Out-of-pocket costs, making sure that we have a network of providers who actually understand our condition and can treat us well. All of those things are really important. And when you look at places like rural Georgia, here we have a lack of doctors. Some people have to, I can't believe this, mothers, like who are having babies, have to travel 300 miles in order to get to a hospital to have a baby. That's ridiculous. So making sure that there's network providers, that people can see a dermatologist if they need to, that's the one. And then obviously out-of-pocket costs, like you shouldn't have to pay just these exorbitant amounts of money to get care and to get the medication that you need.
Yeah, so. Thank you. Lastly, I just wanted to comment, I wasn't able to put it in the PDF, but we do have, and in fact, I had it up if I'm brave enough to try to show you. I'm not going to risk it. So we have a presentation, like literally a PowerPoint presentation that has all kinds of stats in it, research, pictures, and we presented this to the Dermatology Nurse Association, both state level and national. If you guys want that for any reason, I am very happy to share it with you. We can customize it for your story or whatever you want to do with it is absolutely fine. Just reach out to info@ITSAN, or my email is johr@ITSAN, and I'm very happy to share it. Would love for it to get more use. That way you don't have to start from scratch. You just kind of put in your story, your pictures, whatever you want to include. You know, have a meeting at the library. I think we had Donna Rex out in, I think she's in California. She had a community event where she invited physicians to the local library, which will give you space typically for free. And she went through her own presentation there. So there's definitely some opportunity to get that out there. And I think that's all I will share, Kelly. I'm glad you guys saw my email. That was fun.
Okay, so let me get back onto our presentation, and we're going to flip through here. So obviously the first thing you can do, and I'll beat that drum too, report to the FDA if you have not yet. Even if you don't live here in the US, you can do that because they take submissions from all over the world. And the more people that we can report that this is happening, again, the more data we have when we go to the FDA and they can take a look at this and our survey and our stories and all of these different things to realize this is actually happening and we need to do something about it. So getting involved in grassroots advocacy, again, this is delivering the message to bring awareness and change. Right now, we don't have specific TSW legislation that we're going to ask you to bring forward, but what we are trying to do is help you understand the process and get you started. So here's me. I am telling my story to the Senate Health Committee here in Georgia. And yeah, it was scary, but I knew how important it was. And I was just so grateful to have the opportunity to actually show up. So I want to tell you a little bit of my story in the journey that has gotten to me to where I am. Because again, like I said, it's not like a one and done. Like we just go, we show up, we meet our legislator one time, tell our story, and that, you know, close the book. It's all done. We've done everything we needed. When you're wanting to make change, you have to develop a relationship. It's all about relationship. They need to trust you. They need to get to know you. All of these different things play into that. And it's an ongoing process. So what do you need to have to advocate for change? First and foremost, and really at the bottom of it all, you need a willingness to get involved, and you need a confidence that the cause you have is worth fighting for. And so really anybody can do this. There are all different levels of involvement. If you don't feel comfortable having an in-person meeting or going to Washington, DC, or talking to people who are really high up, you don't have to do that. You can do something as easy as calling their office, you know, to let them, hey, I support this piece of legislation. They have to write all that down. All of the things that you do and the action you take makes a difference and will add up. So the lessons from the bath, and I think that most of us have had these. I spent countless hours in the bathtub alone, and I did so much introspective work, so much healing, a lot of stuff that went way beyond my skin and the physical into really deep, deep stuff. Well, as I started to get better, and I could do a little bit throughout the day, like when it was in the worst of it, I couldn't be out of my bed for more than 15 minutes. That's how bad it was. But as my body started to heal, I tried to get more involved with my family, doing things around the house. And it was hard. I'm not going to lie, but I know that, well, I knew that if I didn't get involved, I was missing out on life. And I also didn't want that to happen. My kids were growing up. I felt like I was a burden, all of these different things. I just wanted to contribute where I could and just get back into real life and be a part of that with my family. So what I would do in the morning, every morning I'd have to go straight into the bathtub because the burning in my skin was so bad. I'd sit there for probably about an hour. And that moment of me like getting out of the bathtub, wow, that was a tough one every day because you feel the pain. It's like the air hits your skin. It was a challenge. But before I did that, I would sit there and identify, okay, what do I have to do today? What is the one, maybe it's only one, maybe it's drive my kids to school, or maybe it was put in a load of laundry, or today I'm going to make dinner. I would identify the tasks that I needed to do. And I would decide before I got out of that bathtub, I'm doing that. I would feel like, I don't know how I'm going to have the strength. What if I have this major itch attack? What if I physically just can't do it? I never let that stuff affect me because, and it's funny, because it was like learned incrementally. So when I only did one thing at a time, I realized at the end of the day, oh my gosh, I had the strength to do that. I was able to do that. So the next day, you know, when I'm faced with that again, what's my task for the day? I said, okay, yesterday I didn't feel like I could do it, but I had enough strength, and so I'm going to do it again. That kept on growing in me as a person, and I started to live life again, even though it was scary and it was hard. Well, when I started to get involved in grassroots advocacy and things that I do nothing about, I have no background in poli-sci. I barely remember what I learned in high school about the process. I didn't even know how like bills actually are made and how all of that works. I just knew I needed to do whatever I could to bring awareness to this. So I connected with someone from National Eczema Association by my work with ITSAN. We ran into each other, and I had originally talked to them because I thought we need to get doctors on board and how can we work together and whatever. He told me that there was an opportunity to advocate here in the state of Georgia because they had some certain things that they were trying to accomplish. So I said, well, I'll be your Georgia person, I'll do it. That's kind of how I got involved in advocacy myself. So I was given like the first steps from him of, okay, you identify who your legislator is and you reach out to them. You get a meeting with them on the books. And so I did that. I met with my senator, and you know, I didn't know what to expect. I didn't know what to say. I mean, I had written out some talking points and things to bring up about my story, but I basically just showed up at his office. So you have to understand that these elected officials, most of them have a day job because it doesn't pay them enough to be able to hang out at the Capitol a year. And typically it's only a couple months anyway. So I showed up at his little insurance company and we sat down and I just started telling him my story. And he was like, oh my gosh, you know, you'd be surprised, Kelly, at how little people get involved in this process. But I'm really glad that you came. I'm so glad you told me your story, because without knowing, how are we supposed to know how to do our jobs? How are we supposed to know, you know, what things are important to our constituents? We rely on people like you to come and inform us about what's happening in your lives. That was like a big light bulb moment for me, because I realized, oh my gosh, I'm not being, you know, an annoyance to him. He's actually relying on his constituents to come and inform him to be able to serve in the capacity that he does. We elect those people. If they're not serving us correctly and doing the things that we need, we can vote them out of office. So it's in their best interest to hear from their constituents. And so they want to. So know that. Let yourself be empowered. They want to hear from you. So then he also, you know, was telling me, you know, you really should meet with the head of the Health and Human Services Committee in Georgia, because she could probably help you with some of this stuff. And so she's in this other city. I'm like, oh my gosh, my sister-in-law lives in this city. My sister-in-law happens to be on city council. And so when I said her name, he's like, oh my gosh, Kelly, well, you need to have her set up an introduction, because it's really hard to get meetings with this senator unless you know someone. So again, another lesson that I learned is try to use connections that you have. Like, look at your life, look at the people that you know, see how you can use that, in not in a bad way, in a good way, to make those connections to get you these meetings to keep opening doors for you. So I reached out to my sister-in-law. She set up that meeting. I met with the senator, and it was like one thing led to the next to the next. I ended up shadowing this senator and understanding what it means to testify at a hearing. And I'm writing notes on my phone as I'm sitting there watching, because I'm like, I have to do that. I have to testify before these committees. And you saw that picture before. I ended up being able to do that. But a lot of it is just one door opening to the next, opening to the next, opening to the next. She told me about a coalition that's in the state of Georgia that I got involved in, and that opened up a lot of other opportunities. My work with ITSAN started opening up opportunities, and it's just, you would be amazed at, once you meet people and you start making those connections, how it just continues to grow. So we really want to give you that power today and let you know, just it's all about first having that willingness and having that confidence and just taking the step forward. So as far as, and I know that we're kind of running out of time, so I'm sort of going to fly through this a little bit, but since we're coming from different countries, what works for us here in the US, or what the system might be for us, it's not cookie cutter. It's not going to work in every other country. But what will work is identifying who your stakeholders are. And a stakeholder is a person or a group that has an investment, share, or interest in what you do. So who would care about TSW? So I put down here in the orange, the medical professionals would, academia, legislative, regulatory, like people like the FDA here, industry, so pharma companies, and then researchers. All of these people would have an interest in TSW. And then you start identifying, okay, who do I know locally? That's where it's the easiest to begin, and honestly, the fastest to see any change take place many times is just on the basic local level. Like Jodie mentioned, you can reach out to your doctor. You can talk to school nurses if you have a child who's going to school with TSW. You can reach out to your mayor and say, hey, this is what's happening. Do you know anybody that I can talk to, or do you know how we can change this? You can talk to your community health centers. With your state, you can go to your medical societies. You can go to your legislators, you can go to industry. They have a lot of reps who work many times at your capital, universities and hospitals. The nation, we've spoken with American Academy of Dermatology, the American Academy of Family Practitioners and Pediatricians, American Medical Association, FDA, Congress, industry, and the list goes on and on. So these are all people who yes, we need to connect with somehow, we need to get there. But as I mentioned earlier, you can't just jump all the way to the top many times. You have to go through the right order of things and speak to the people who actually can get you to the next level. So just want to let you know too, again in orange, that you have a powerful story, and there are thousands, if not millions, of people who need you to speak up. And change is largely driven through relationship. It's through honesty and storytelling. It's through dreaming and envisioning with these decision makers, and it's by calling them up. And I think there's a fine line between calling people out, like, look what's happening, look what you allow, look what you did, and calling people up to, you got into this position for a certain reason. You want to help people. This is a way that you can help people. This is how we can work together. Like Jodie said, we're all emotional about this. Believe me, I've gone through my periods of like fury about what happened to me, all of the loss in my life, the loss in other people's lives. But if that's all you bring to the table, that doesn't get very far. It's like you have to be able to channel that in a way that's productive. And when you start seeing the change happening, it is so rewarding, because it's not just for you, it's for countless people. You are changing the world. So this is a really big deal. Do you know someone who can make introductions for you? That's what I mentioned before. The higher the position of the authority, the harder it can be to secure meetings. So start somewhere, even if it's on a local level. You just start, and you'll start making those ways up. Your legislator wants to hear from you. They work for you. They rely on the information from you to inform their decisions and make the laws. If you want change, you have to show up and then have the courage to speak. One door leads to another and another and another. And I can't tell you how many times, guys, I was in a room and I can feel my pants quivering on my legs. It's scary. Plus, it's my personality. Plus, we're bringing a message that many people don't want to hear. So, but the thing is, when you realize how important it is and how just you showing up and having a seat at the table is going to make profound change and help stop the suffering, it's totally worth that. So, oopsies. So getting started in grassroots, this is kind of the technical stuff. Jodie's always really good about, what are my next steps? And I love that, because I can hear that in my head sometimes when I do things like this, because I'm all about like, let's get inspired. I was like, okay, but now what are the technical next steps to actually start doing these things? So what you can do first is find out who your elected officials are. You can look up online. You just put in your zip code and they will pull those people up for you. Set up a face-to-face meeting with them. Either virtual, since things are kind of weird right now, or maybe you can meet them in person for coffee. Tell them your story, what you'd like them to do. Ask for their help. Hey, do you know anybody who I can talk to about this? Many times, like I'll tell you, my senator who you saw in that picture before with the spiky hair. First of all, I'll tell you that like after a year of knowing him, he texted me out of the blue, Kelly, my wife has the skin rash. We don't know what to do. The dermatologist gave her something. It's not working. Can you help? I ended up going over to their house and bringing some stuff that I use, but that's the kind of relationship that starts building. And so we're friends on Facebook. It's like, hey, back in the day, I always thought of politicians as robot people, like they're not humans, but they are. It's like they're your neighbor or your brother-in-law or whatever. They're human beings. And that's the way that we connect with each other and help bring change, is through that relationship. And then he was also the one, when I was trying to figure out about, you know, the Chinese medicine that I was using, I was concerned if there were steroids in there. I wanted to get them tested. I know Georgia Tech is one of like the best universities here for stuff like that. I was reaching out and said, hey, does anybody know of anywhere that I could go? He was the one who went to Georgia Tech himself. And he told me, I know this person who's in charge of the biology department. I'll connect you with them. He opened that door for me. And because he reached out and did that intro, like I had mentioned before, hey, so-and-so, I have that my constituent wants to test these things. Do you have any programs that you could do that for her? They did it for free. And that's not only a very time-consuming process, it's a very costly thing to do. So just because you know someone, they can open up a door for you. So can't stress that enough. So leave them material to look over after you're gone. And once you tell your story, you're going to hook them. When you make that human-to-human connection with them and they see, oh my gosh, like what you went through, they see your pictures, they're going to be thinking about that at the end of the day, you know, or when they go on throughout their day, they're going to be thinking about you and your story. If you leave them some material, that helps them to refer back to it and look into it more. Like Jodie was saying, they can look up at ITSAN. They can look at, you know, these published statements that have been put out by the British Academy of Dermatology. That's important because you want them to keep thinking about that. When you meet with them afterwards, always follow up and thank them and send a picture so they can remember you if you took a picture with them. That's a great way to keep that connection going and growing. Follow up with them after you've taken action and keep them in the loop. So, you know, like this contact that I had with Georgia Tech, it's so good to go back to my senator and say, thank you so much. This is what we're doing. You know, because you opened that door for us, this is really helpful. Say yes to opportunities, even if they scare you. You have no idea where they will lead, and let us know how we can help you, because that's what we're here for. So some tips I just wanted to throw in here. I already said this one, speak your truth, even if your voice shakes. I love that. I see it as a meme in my head because I'm sure it's out there. Look and act professionally, because if you take yourself seriously, so will other people. I've been to the Capitol and different places where people show up in their sweatpants and they're like, well, this is me, you know? Okay, sure, that is you, that's great. But a lot of times if you look professional, people are gonna take you more seriously. So write out your story and add pictures. They speak 1,000 words. A lot of times you don't have an hour to talk to someone, you might have 20 minutes. So if you have pictures, it's like, wow, you know, that speaks a lot louder than 10 minutes of dialogue. Bring material to back up your story. So not just your story, but bring evidence, like we were talking about, prevalence and proof. Bring that sort of evidence that you can leave with them. If possible, have your doctor show up with you. If you have a doctor who's supportive of you, bring them. It's so impactful when you have kind of like that 2-punch thing where you have a patient story and you have a doctor backing that up and saying, these people need help and we're working together with them. That's huge. Follow up and build relationship with your elected officials. I mentioned that already. And also remember, it can take 3 times before a new message or concept begins to sink in. So don't get discouraged. A lot of times when you say it for the first time, people will be like, ah, and then they've got all this pushback. The second time you bring it up, they're like, yeah, you know, they might have their reasonings. The third time, they may start to think about it. But a lot of times it takes that kind of persistence. Like I said, next is the squeaky wheel that gets the grease. Don't get mad, don't get discouraged, just keep your message going. We have a truth that we know is happening and something needs to change. So we're not gonna just turn around and walk away and forget about this. It's too important. So be mindful of your tone. A loud, angry message might knock the door down, but it eventually will also get it slammed in your face and anyone else who comes along behind you. And I just wanna say from my personal experience, some of the history that went on with ITSAN and some of the people who really lashed out made it very difficult as we've been trying to make progress to build those bridges back up. And I can't tell you how many different doctors, well, it's not countless, I mean, but it's the important ones that I've gone to try to talk with and try to make some progress with. And when they hear, you know, what I'm about, it's like there's instant prickles. Like they don't want to talk to me. They don't want to give emails. They don't want to work with me. And that's because of the past. That's because of people name calling, insulting, bashing. That doesn't make progress. It gets the door open, it gets people's attention, but it doesn't make real lasting progress. So it's like we have to we have to use the anger to channel. So don't repress your anger. Don't say it's not important, because it is important. There's a reason you're angry. But we have to use that in the correct way. So if you want to make progress.
Just a quick note, Kelly, you and Kathy both have done such a fantastic job of building those bridges in industry. I think that's a huge reason. I mean, the reason that ITSAN has been so successful in the last couple of years is the work that you and Kathy have done.
Thanks, Jodie. And I will say, guys, just to let you know about the industry, because you touched on that, and we haven't talked about that much. I know a lot of people in our community are so up in arms about having any type of relationship with pharma, because pharma just wants our money. They want to keep people sick, big bad pharma. But I remember
they're making lots of money off of steroids, which is not true. It's super cheap.
But a friend of mine told me before, whoever is part of the problem needs to be part of the solution. So if they cause a problem, you need to loop them in. They need to be accountable and to be part of the solution. So when we started talking about this survey, that takes money to run those things, to develop it, to field it, like tens of thousands of dollars. It's a lot of money to do something that extensive. You have to get something called IRB approval, so it's scientifically recognized. You need to have medical professionals look over it. It's a really big deal to do that. It costs a lot of money. Like we said, ITSAN doesn't have funds to do that. Otherwise, we would have done it 10 years ago. You know, when we talked to some of these pharma companies and told them what was going on, we showed them those books and the pictures, they were shocked. Like the patient advisory people that we talked to, they were very surprised. They said, how can we help? We had 2 companies that actually helped fund that survey for us. So just so you know, it's not all bad. It's all about like understanding all the people who are involved here and how we can work together to help patients. Understanding the landscape, right? And understanding the game. So that is a segue into this one. If you want to make progress, you need to keep an eye on the big picture. What are we trying to accomplish here? Understand how the game is played, how these changes actually happen. It takes time. It's not an instant fix. And sometimes you have to talk to people who you're really angry at, but they're part of fixing the problem, right? Learn about how laws are made, learn who makes the guidelines around eczema, who regulates drugs and how, where the physicians are getting their info from. So in different countries, this is going to look different. You can ask questions, you can Google it and learn a lot from the internet. But again, if you need help, reach out to us. We're here to help you with that. And with that, here's our email addresses. You can, let us know if we can help you with something, if you have questions about the Advocacy Toolkit, etc. So we have 3 minutes, which I don't mind going a little bit over if y'all don't mind going over a little bit.
Yeah, Kelly, thank you so much. I mean, I hear the passion in your voice when you talk about this, and I know you've done a lot of advocacy work with other organizations as well. And it's phenomenal to hear that in your voice and to, I think, help us all feel like we really can make a difference. Mm-hmm. We do have one question that I wanted to make sure got addressed in the Q&A about board member requirements. And Sam, I know you had some questions too that were more personal to your medical condition. I think those are important questions, but I think we should also save those outside of this group, so maybe we can connect afterwards if you'd like. But the requirements or expectations to be a board member, it's pretty minimal. It's a 2-year commitment. You need to come to at least half of the board meetings in a year. There is a time, it's a balance between time or funding. Most of us put in a lot of time, so the funding requirement isn't even a factor. But yes, we would love to have you join our next meeting and consider kind of going down that route of being a board member. Do it.
Have you been able to go through the chat and the questions, Jodie, to see if there's any?
Yeah, I think we're good there. I haven't stayed on top of all of them, but he was saying looking professional and being in TSW, bit of a challenge. She sighs.
Agree. And it's funny because I would always flare up before a big meeting because I was stressed out. So I always felt embarrassed, like going and my face is all puffy and stuff. But I thought, well, I guess if anything, this proves my point, right? And they can
Exactly. Exactly.
but it's not easy. I agree.
Well, thanks everybody for joining today. Really appreciate your interest in this and your time. Please absolutely reach out and let us know how we can help. That's why we're here, because we want to make a difference. And I'm thinking of ways that we can keep this conversation going. I was talking to Kelly about that earlier. Maybe we can have another one of these or an offshoot. I hate to set up yet another Facebook group for TSW, but I'd love to be able to keep the conversation going and understand how you're progressing or successes that you've had. I'd love to be able to share those with the community.